A first day of therapist school, therapy 101 thing that we learn is that we're not supposed to give our patients, clients, advice. We're not your friend. We're your therapist. There's money exchanging hands. And our goal is to work with you to not only alleviate distress and suffering and create safety, but also to give you tools to build your capacity, to foster authenticity, to cope with stress. Depends on the therapist, but we want you to do it. Therapy, when it's done right, and frankly, I believe ethically, does not foster a dependency between the client and the therapist, but rather, we are trying to help you fly on your own, foster your autonomy, your independence, your trust in yourself, and to provide you with tools and teach you how to use them. And then leave you to decide how you will use them now that you know how, and then you might use therapy less or end up not be needing therapy anymore. And as part of that, we don't give advice. We may shine a bright spotlight on stuff, but we want you to get there yourselves, right? Some people get frustrated when they come to therapy thinking they're going to get a prescription for how to fix their lives. That's actually not how therapy works. I'm just giving you that. Now, I'm going to be very honest here, and I can only speak for myself, so I cannot speak for all therapists. I can say this for myself. Therapists are human. And all things being equal, a human, good, ethical therapist, we want good things for our client, right? And our most basic commitment, the oath we give, is that we do no harm. And above that, we facilitate your growth. So you better believe that there are outcomes I, as a therapist, desperately want for anyone I talk to. Personally, I know I've had decades to hone a poker face. So when a client's talking to me, I'm thinking, please leave him. Please leave him. You're so much better than this. He is never going to change and he's never going to stop cheating on you. And I can see how smart you are and you'll be fine. But as I'm thinking that, I just have to stay calm and ask things like, what are you seeing as safe options? How are you feeling? What are you hoping for? But inside I'm like, please go, right? Folks, we're rooting for you. But I'm not your best friend who's screaming, break up with him. I do that with my friends. But whatever you decide about whatever you are managing, as good therapists, we are supports and a gentle guide. But we don't get to have an agenda for you. That agenda has to stay under that poker face.